Hello, and thank you for being part of this taped interview, which is part of Bionews Services' official coverage of ECTRIMS 2017. So, Genentech has shared a large collection of new Ocrevus data here at the meeting. Presentations that include how Ocrevus performed in phase 3 trials. For instance, the treatment was shown to lower brain atrophy, that is, brain wasting, in patients with NIDA compared to those treated with interferon. So could you please explain a bit about the clinical implications of this finding in terms of how the disease develops in patients, and maybe say something about how a slow loss of brain tissue would impact disease progression over time?
Mm-hmm. Loss of brain tissue is a very important measure for patients. Loss of brain tissue has been associated with disease progression. It's been associated with cognition deficits. So it's very important for patients that we maintain as much brain tissue as possible. And our data here at ECTRIMS shows that patients that have NIDA, or no evidence of disease activity, have a 30% better preservation of brain tissue compared to those patients that don't have NIDA. And furthermore, our data show that there is a preservation of gray matter volume as well as white matter volume in patients with NIDA and patients that have been treated with Ocrevus versus interferon beta. So it's very, very encouraging data.
So subgroup analysis in the Ocrevus studies showed that both relapse rate reductions and NIDA were similar across different subgroups of patients. Are you doing any studies to identify patient characteristics among those who respond versus non-responders?
So we're continuing to look at our data very carefully for a response across the broad range of relapsed EMS patients from our Ocre-1 and Ocre-2 trials. Those are very large trials. We have a very large data set. So we're looking very carefully to understand how Ocrevus is effective in various groups of patients. And as you see in the data we present here, we have a strong effect across all the various subgroups looking at baseline demographic, baseline disease characteristics. So we have a broad range of effect that we see so far.
So an analysis also looked at patients with relapsing disease, showing that disability progression may be ongoing even in the absence of relapses. Ocrevus showed that disability progression was slowed compared to interferon. So does this suggest that Ocrevus could be effective in patients with non-relapsing secondary progressive MS?
So underlying disease progression is very important for patients, both our MS patients and primary progressive MS patients. Underlying disease progression appears to be driven by chronic inflammation, and this can lead to very significant impact on patients' lives, their mobility, their quality of life. So we really want to look at that underlying progression very carefully. And here at ECTRIMS, we've introduced a measure called PIRA, or Progression Independent of Relapse Activity. And there we look at progression that's independent of the relapses. So the progression appears to be driven by chronic inflammation. And there we see, with our PIRA measure, we see a significant reduction in this progression compared to interferon beta.
So would this suggest that Ocrevus targets different types of inflammation? You mentioned that disease progression is linked to chronic inflammation, that its effects are actually multifactorial.
Yeah, we believe that Ocrevus attacks both acute and chronic inflammation. Acute inflammation can often be measured with relapses and GAD lesions. Chronic inflammation, as I mentioned, we can measure with this new endpoint called PIRA. We can also measure potentially with a new measurement we're also introducing here called cells, SELs, for slowly expanding lesions. And those slowly expanding lesions appear to be potentially a marker for chronic progression. And we have a presentation here that describes the methodology. The methodology that we introduced is new because it's an automated methodology on standard conventional MRI measures. So we're excited about this potential marker for progressive inflammation.
Have these new findings influenced Genentech to consider studying Ocrevus in non-relapsing SPMS patients?
So as of now, we don't have a study on non-relapsing SPMS patients. But as I mentioned, with this PIRA analysis, we're able to look at progression independent of relapses from our OPERA-1 and OPERA-2 studies. Furthermore, we looked at a subgroup of patients from those studies. The subgroup was defined as patients who might likely develop SPMS in the future. And there we see an even stronger reduction on PIRA. There we see a 40% reduction on PIRA compared to interferon beta. So we're not saying that we have an effect on SPMS, but it's potentially could lead to very interesting findings in the future.
Genentech also provided updates on Ocrevus safety data, including cancer risk. This analysis showed that cancer risk was basically similar in Ocrevus-treated patients and in placebo-treated patients in the oratorio study, and also in the OPERA studies comparing to interferon. And as I understand it, you also compared to older MS trials. But the initial data showed an imbalance, particularly in the oratorio trial. Did Genentech perform analysis looking at the trial separately, and how did that data look?
Yes, that's correct. Patient safety is extremely important to us, so we're committed to ongoing safety and looking at safety on a chronic basis. And as you mentioned, our data so far shows that we have safety that's compatible with what we saw in our double-blind period. In other words, we see no increased risk of any safety events, including malignancies. And we have malignancy rate that is in line with control arms of MS trials, as well as epi-data for MS trials. We have a very, the rate is the same as we saw in the control period.
And data showing sustained progression or a decreased risk of progression in PPMS patients also strengthens the case of Ocrevus as a treatment for this primary progressive patient group. Are there any efforts ongoing to identify specific markers of non-response among progressive patients? Or primary progressive patients, sorry.
Mm-hmm. So as with our relapsing MS study, we have ongoing efforts to look at our PPMS data set, and we have over 700 patients that were treated in our phase 3 PPMS trial, and we have an effort looking at various groups to look at the overall effect and to understand the overall effect of Ocrevus in this group. And putting all the RMS data and the PPMS data together, we have a very rich data set to look for that.
So we might see more markers of response in future analysis. Is that correct?
We're looking very carefully at that to really understand the effect of Ocrevus across the PPMS spectrum. Yes.
So could you please tell us a little bit about the OBO biomarker study? Are there any new data emerging that supports the use of new MS biomarkers?
Yeah, so the OBO study is very exciting. It's a study where we're looking at a variety of biomarkers, both in blood and CSF, on patients that are treated with Ocrevus, and that's mostly RMS patients, but we also have some PPMS patients in the study. And so we're very excited that we might be able to understand the effect of Ocrevus and the mechanism of effect of Ocrevus in those studies.
Will these results possibly also tell us something about MS and its development per se?
Sure. We're going to have a lot of data from both blood and CSF, a variety of biomarkers, T-cell data, B-cell data, a variety of other soluble markers. And so, yes, we'll advance the understanding of MS. And this really shows our commitment to MS. The Ocrevus data showed a significant effect in our primary studies, but we're continuing a variety of other studies to really advance the field in MS.
As you mentioned, that you have many studies ongoing. Could you please comment about the progress of the different Ocrevus trials?
Yeah, so we're seeing a lot of enthusiasm in our trials. So both in our post-marketed condition where we have a number of patients, we have 20,000 patients in total that have been treated with Ocrevus, either in the post-marketing setting, so in other words, the commercial Ocrevus, or in a variety of trials. We see strong enthusiasm in both cases.
So enrollment is not a problem given that Ocrevus is now approved?
That's correct. We're seeing very, very strong enthusiasm in both approved areas as well as in these trials ongoing.
So is there anything else you want to add that we haven't talked about yet or to further emphasize?
Sure. One of the other areas that we're very excited about is what we call Floodlight. It's a smartphone-based technology here that we're introducing here. And it's a way to monitor patients, and a way to give back to patients and physicians, a way to understand what's going on as far as chronic progression in these patients are concerned. Floodlight has two components, the passive component and active component. Passive means the patient does not have to do anything. We have continuous data collection using machine learning, advanced data analysis to see whether we can detect progression in these patients, as well as active component where we're actively asking patients to test themselves. For example, there's something called a pinch test on the Floodlight technology, and there we can see whether there is evidence of progression in these patients.
And in what way will this data complement information that is collected through clinical trials or clinical visits?
Yeah, so it's a way to really understand whether there's something that's measured, that we can measure underneath the surface. So clinical visits measure patients at the visits, but this is a way to look at patients in between visits to see whether we can help patients identify things that they don't notice. And so this is a real big effort for us. The other thing I wanted to mention is that this is the largest data set, Ocrevus data set, presented at any Congress to date. And it really is a testament to our commitment, Roche's commitment to the field of MS. And this is also an example where we're committed to neuroscience generally. So we are committed to MS. We also have large efforts in neuroscience and Alzheimer's and spinal muscular atrophy and other diseases as well. So we're very committed to MS and other neuroscience diseases.
Thank you.